My name is Audrey Farron, and today we're going to be talking about Dorothea Orem's self-care model for Bethany Mello's class at Northwest Nazarene University. You may be asking yourself, who is Dorothea Orem and why does she matter? Well, we are going to look over who she was and discover why she was important in the nursing community. First and foremost, Dorothea Orem was a nurse. After working in multiple areas across healthcare, she turned her focus to education. Throughout her time as an educator, she started to see broken areas within the system and decided to write her theory. She first earned her RN from Providence Hospital of Nursing in D.C. After that, she earned her BSN from the Catholic University of America, also located in D.C. In her continuing education, she earned her MSN in Nursing Education in 1945 from the Catholic University of America. Her career as an educator took her from the Providence Hospital School of Nursing to the Indiana State Board of Health in the Division of Hospital and Institutional Services, to Catholic University as an instructor and dean, all the way to the United States Department of Health, Education, and Welfare. Orem is remembered for her theory of self-care, published in 1959, which includes three theories: the theory of self-care, the theory of self-care deficit, and the theory of nursing systems. Let's talk about her first theory, self-care. Orem's theory proposes that people have a natural ability for self-care, and nursing should focus and recognize area where a deficit is possible. With this recognition, nursing is in a position to respond to the deficit by supporting self-care. Orem said, the term self-care means care that is performed by oneself for oneself when one has reached a state of maturity that is enabling for consistent, controlled, effective, and purposeful action. Now, let's move to her second theory, the theory of self-care deficit. A self-care deficit occurs when the relationship between demands for self-care are greater than the individual's current ability, such as a patient who can usually independently ambulate, but now, after having a hip replacement, needs assistance to ambulate safely, or a patient who has become very weak due to illness or injury now needs help to simply brush her hair. Her final section of this theory is the nursing system, which contains three parts: wholly or total compensatory, partially compensatory, and supportive educative system. The nursing system steps in to play a role by the nurse facilitating self-care via the term Orem defined as nursing agency. Simply put, this is the nurse's job. The nurse has three different ways they can help a patient with involvement in their own care based off their compensatory needs. The first is wholly or total compensatory. This means we are doing all cares for the patient, such as feeding, bathing, transferring, and any other needs the patient may have. The second way is partial compensatory. This means we are going to aid the patient in their needs to help them care for themselves as best as possible. Examples include a standby assist to ensure patient safety as they ambulate, or assisting in dressing each morning due to a decreased range of motion. The final way is supportive or educative system. We are educating our patients about their specific needs, including diagnosis, treatment plan, necessary lifestyle changes, and safety measures that need to be taken at home to prevent further injury or illness. So what? You may be asking yourself, why does this matter? I do this all the time with my patients anyway, so why would I need a theory to tell me what I already know? Well, let's explore a few studies that have implemented Dorothea Orem's theory and look at their results. In our first study, O'Shaughnessy studied the implementation of Orem's theory into peritoneal dialysis at home. Her theory was an integral part in teaching patients how to perform therapy independently. Nursing agencies went into the home of the patients to assess self-care deficits with each patient and promoted daily self-care. This home care option was carefully analyzed for each individual, assessing their emotional readiness and cognitive function. O'Shaughnessy's results showed that older patients were more apt in self-care than younger patients because they were prepared to enhance their quality of life and were more comfortable with life changes. The nurse was able to identify the patient's capacity for self-care, any deficits, and utilized a nursing system to gauge the patient's need. Another study showed a similar approach taken in addressing patients with type 2 diabetes. This study approached the efficacy of teaching patients to care for themselves at home successfully, revealing that effective education and support gave patients autonomy and improved health outcomes. Orem's self-care model is one of the most complete self-care theories that provides a good clinical guide for planning and implementing the principles of good self-care. Orem believed that human beings can generally take care of themselves, and whenever this ability is distorted in a person due to illness or injury, nurses can help individuals to regain this ability by providing direct care and compensatory educational support at any level as an agent and facilitator for change. Orem defines self-care as effective, learned, informed, and the objective activities and behaviors of a person that are done in concrete situations of life by the individual person or loved ones. She suggested that the aim of self-care is to regulate the effective factors on growth and patients' performance in relation to life, health, and well-being. She believed that patients should be able to care for themselves as unique individuals. She also believed and taught that nursing is action. Nurses are educated and trained to be deliberate facilitators for change. Self-care behavior is affected by the total skills and knowledge that a person has and uses for their practical efforts. Self-care is considered an important and valuable principle because it emphasizes the active role of patients in their own healthcare. Many healthcare organizations and healthcare providers consider promoting self-care as a strategy to reduce the high costs of medical services. As you go throughout your career, ask yourself these questions. Have you seen failure in patients where this model could be beneficial? How would you implement this model into your future practice? How have you seen this model in your line of work? As you ask yourself these questions, you may be surprised by your answers.